So friends, let's begin with a few FMG questions which has been asked in the recent examination from 2020 from this very particular topic. It is a very common topic nowadays to ask images. This is probably one of the most important source of questions where you can just go through lots of radiological images like X-ray, MRI, CT scanner, ultrasound. And like, for example, this year in FMG exam in 2020 August and December, there a lot of questions have been asked from these topics. So ultrasound is probably one of the very important topic, and just from in just one exam, there were around 3 to 4 questions just based on the ultrasound images. So let's come to the first question, which was asked in recent FMG examination. So if you can see this question, identify the pathology given in the ultrasound image. Obviously, they have mentioned that it's an ultrasound image, but otherwise, what are the other ways where you can find out if it is ultrasound image or not? So as we have discussed in our discussion, whenever you see an image in the exam which is not covering the whole cross section of the patient, and if you see this kind of curvilinear and at that particular point of one end of the image, then presume we are looking at one image which has been scanned by using a low frequency probe or a curvilinear probe, which is like this. So although they have mentioned this is an ultrasound image, but if you see this ultrasound image now, as we already discussed the particular things, that on ultrasound, they probably should have mentioned if this is a right hypochondrium or which side it is. But we can see this is a pear-shaped structure. This particular structure is a pear-shaped structure like this. And this is there is the liver. So this is in the right hypochondrium. When you see this particular image, what you have noticed that there is almost a jet black structure, which is what term we use for such things, anechoic. So there is something which is anechoic, which is pear-shaped, and which is in the right hypochondrium. So what we are dealing with right now, we are looking at the image of a gallbladder. What you need to notice in this particular image, or which is very remarkable, is that the anterior wall is very clearly seen. You can very clearly see the anterior wall of the gallbladder. You can see the fundus of gallbladder as well. You can see the neck of gallbladder as well. However, what you can't see is the posterior wall. So posterior wall is not visible because it has been covered by a dark black shadow. And if you notice this thing, that there is some shadows going like this. And rather than having a smooth posterior wall, what you can see, these irregular rounded things. So this is a very important sign on ultrasound, and what we call it, acoustic shadow. And where all we see acoustic shadow? What are all places where you see acoustic shadow? It can be seen by air. It can be seen with calcification. And can be seen with stones or calculus, bone. So these are the places we already have discussed. These are the places where we see acoustic shadow. So based on this, what we can see, the air, if would be there, it will be in the non-dependent part. However, what we see, it is in the dependent part. It is not in the non-dependent part. So it is in the dependent part of the gallbladder. Air would have been there along this portion of the gallbladder. So it is something dependent in the gallbladder. What is the commonest thing which we see dependent and which is echogenic? So these air calcification stones, these all are echogenic. What do we mean by echogenic? Echogenic is nothing but bright. So on ultrasound, these things are echogenic and bright and shows distal acoustic shadow. So what is the most probable diagnosis for this particular question? It is cholelithiasis. So had the same kind of echogenic bright focus would have been there in a thin tubular anechoic structure like this, like on this side, this one, which is like a tube. If we would have seen a bright focus there, probably my diagnosis would have been cholelithiasis, which is stones within the CBD. But this one is actually cholelithiasis. Okay. So the answer for this question is cholelithiasis. Let's begin to the next question. So what was the next question asked? they showed this image and asked, identify the pathology given in the ultrasound image. So again, they have mentioned that this is an ultrasound image. However, what I always ask you to do, that whenever you see not a cross-sectional image and you see at one end of the image this curvilinear structure, also this curvilinear area, it means we are using low frequency curvilinear probe to acquire this image, and this is an ultrasound image, although they have already mentioned in the exam that this is an ultrasound image. So identify the pathology given in the ultrasound image. Again, they did not mention what exactly or was the place where this image has been taken. So probably these questions are based on recall. So I'm presuming they must have mentioned that this is an image from the uterus, or maybe a gynecological examination. So identify the pathology given in the ultrasound obs gynae or ultrasound uterus. This is what they need to mention. Otherwise, just on the basis of this image, the similar kind of pathology we can see at a lot of places. So identify the pathology given in the ultrasound of uterus on this image. What is the most remarkable finding you are seeing? That there are multiple cystic areas. We know cyst or fluid containing structures on ultrasound are black. They are anechoic, jet black, and as well as they have multiple bright septations like this. So these are multiple bright septations, and when you see this kind of appearance, there is a sign, what do we call? Snow storm. So this is a typical sign known as snowstorm sign. So this is a snowstorm sign seen on ultrasound. And where do you see a snowstorm sign on ultrasound? The diagnosis for this one is high density-form mole. So on ultrasound, in cases of high density-form mole, you see snowstorm sign or snowstorm appearance. So the answer for this question is this. When they see or show these kind of images, be very careful. Just try to look for these curvilinear thing there, because that will be a very good hint that this is an ultrasound image, although they would have mentioned this, that this is an ultrasound image. Also, they need to mention the site as well. However, this is a recall based question, so they didn't mention. Let's come to the third question, which was asked in the recent FMGE exam, and that is, what is the probable diagnosis shown on the given image? So there is again one image shown, and again follow the same rule, although they have mentioned ultrasound, but again I see this curvilinear thing there. That means some things has been acquired using low frequency curvilinear probe. So a low frequency curvilinear probe has been used to acquire this image, and again they need to mention that what site is this. So shown on this given image, this is a gynecological examination again, and as we know, the best screening test or the first line of investigation for any gynecological or obs scanning is what? It is nothing but ultrasound, for obvious reasons, because it is real time, quick, cheap, as well as it does not cause any harm to the fetus or mother, because this is absolutely non-invasive imaging. So on this image, they have shown the gynecological imaging of one of the adnexa, and what we are seeing on this image is nothing but ovary, be it right or left. What are the important characteristic signs you would see on this image? That whatever this ovary, it is slightly bulky. So ovary is slightly bulky. Second, this portion of the ovary is slightly echogenic. And what we use the word for this? That echogenic stroma. Echogenic stroma. So this is nothing but echogenic stroma of the ovary. The ovary is bulky. And what's the third remarkable thing you are seeing on this one? That there are multiple cysts. There are multiple anechoic cysts which are arranged peripherally like this. So when you see multiple small cysts arranged peripherally, small cysts at periphery. These three are the classical features of what? Where do you see these three classical features? That ovary is swollen, the stroma is echogenic, and there are multiple tiny or small anechoic cysts arranged along the periphery of the ovary. This is a classical of polycystic ovarian disease. This is classical of polycystic ovarian disease. What you need to remember, if this particular ovary is replaced by multiple large cysts like this, and you can't see any stroma, and this is how the entire ovary looks like. And these cysts could be very big. If you see these kind of thing, this is a classical of ovarian hyperstimulation syndrome. So when you see tiny cyst along the periphery of ovary, this is polycystic ovarian disease. While when you see multiple large variable sized anechoic cysts within the ovary, what we are dealing with, we are talking about ovarian hyperstimulation syndrome. And where do you see that? When a patient is undergoing treatment for infertility. So when a female patient is undergoing treatment for infertility, they tend to develop such kind of cysts. So the answer for this question is polycystic ovarian disease. Let's come to the next question, which was asked recently, is characteristic spectral waveform of venous blood flow in peripheral vessels. So this is probably one of the most important topic in ultrasound, or maybe from radiology, where you need to understand the principles of Doppler and how Doppler works. What are the basic things you need to know about Doppler? I'll quickly go through it, and then let's come back to this question. So what you need to understand, that Doppler is nothing but it is frequency shift of sound. So ultrasounds are based on sound waves. When something's traveling towards the probe, the frequency increases. When something's going away from the probe, frequency reduces. So when frequency increase, it is towards the probe, or vice versa. And when something's going away from probe, there is reduction in frequency. When there is this change in frequency, what happens? We exploit this Doppler property where we color code these frequency shifts into different colors. Whenever there is increase in frequency, we code it as red. Whenever there is reduction, we code it as blue. And that's why whenever we would be doing Doppler, and these color coding is purely subjective. However you want to do it, you can do it, but this is purely conventional. Whenever there is an increase in frequency during frequency shift, we give it a red color on our machines, and whenever it is reducing, it is blue. Or in other words, when something's coming towards the probe, the color changes to red. When something's going away from the probe, the color changes to blue. So this is what you need to understand. Probably one of the most basic thing before we can go ahead in the ultrasound. So if this is a vessel and something's flowing, and let's say this is a ultrasound probe here. If something's going away, this is what you're gonna see within the vessel. So this is if blood is flowing in this direction. However, if blood would be flowing in this direction and we are doing Doppler examination, what will happen? The color will appear like this. This will appear red. So this is the basic principle where we exploit the shift. The second thing which you need to remember is the spectral waveform. So what we do in addition by using ultrasound, we put a cursor within the these vessels, center of these vessels, and that particular cursor tells us the phasicity of that flow. So the direction of flow is color coded, while the phasicity is detected by putting this cursor and then starting the graph. So as soon as you put this cursor, there are 3 or 4 possible standard graphs which you would see. The first is, if you see the flow pattern in that particular vessel in this form, where there is so what is happening here? Sharp upstroke, then below the base, and then above the base. When you see these 3 things, that there is a change in the direction of flow within a vessel is happening in one cycle for 3 times. So once forward flow, then backward flow, and third is again forward. So whenever direction is changing, we consider that one phase. So forward to backward is one phase, backward to forward is another phase. So this is a typical triphasic. This is a typical triphasic waveform. This is typical triphasic waveform. And where do you see it? In the peripheral resistance vessels. And what are the peripheral resistance vessels? Nothing but arterioles. Nothing but arterioles. Okay. Let's come to the second waveform. When you see that there is systolic upstroke and then diastolic like this, then systolic upstroke, then diastolic like this, systolic upstroke and diastolic like this. When this kind of flow is happening, what is happening? There is a forward flow, systole, and this is diastole. In diastole as well, there is forward flow. So forward, one, and in diastole as well, forward. When there is no change in the direction, we just call it monophasic. Monophasic. And where do we see monophasic flow? In all those places where we need constant blood supply. So all the visceral organs, visceral, brain, kidneys, liver, then placenta. So we already have discussed that all those places where we need constant blood supply, we need to have monophasic blood flow. So in all these places we have monophasic blood flow. And what is diphasic? When there is a forward diastole and backward, then forward diastole and then backward. This is known as a biphasic flow, where there is a systolic forward, diastolic backward, and there is no third flow, but only two flows. So this type of waveform is biphasic flow. Again, this is seen in arteries with distal obstruction. Distal. And where do you see arteries with distal obstruction? Like in Burgess disease and those places. Sometimes you see that because the peripheral arteries have lost their elasticity because of the Burgess disease and atherosclerotic changes, what will happen? Whatever systolic flow would be there, there would be not enough recoil for the forward diastolic flow. So there would only be the systolic flow and backward diastolic flow. There won't be any forward diastolic flow, and this kind of pattern is known as biphasic. What is the most important thing about the veins? So what happens in veins, that there is not enough elasticity in the vessels or in the arteries. So whenever you will be doing the spectral waveform of this vessel, the kind of pattern you will see is like this. So what is this? There is a slight up and slight down kind of undulation in the waveform. So essentially this waveform stays like this above the baseline. It never goes behind. There is always, obviously the flow is in a backward direction towards the heart, but it is always forward flow. It never goes into the backward flow. So this kind of pattern is just one phase, but we don't call it phasic because there is no phase. So we don't see any phasicity in the flow within the vein, and this slight undulation is not phasic, but it's because of the respiratory, breathing artifacts, or because of the heart activity. So because of the cardiac activity and because of the respiratory change in the like inspiration and expiration during that phase, there is slight change in the vascular flow patterns, and that gets reflected into the veins, and that never happens with the arteries. So you see this slight undulation, and we call it respiratory phasicity, but it's non-phasic otherwise. There is no different phase. It is always in one direction with slight undulation. That is nothing but respiratory phasicity, and we call it non-phasic otherwise. So if let's come back to that question again. What was the question? Characteristic spectral waveform. So what they're asking, the spectral waveform, which is nothing but a Doppler phenomena, and in the venous blood. So they are talking about the veins. So we already know that veins are show non-phasic spectral waveform. So these are a few questions which were asked in the exam, and if you go through that video on ultrasound, on my videos on this Acexam platform, you would be able to answer all these questions, because these all have been discussed in very in-depth details. And I hope you can probably answer any such questions which would be asked in the exam again, because they are all based on the similar kind of principles. Thank you.